In the mid-1990s, a powerful new painkiller entered the American market. Doctors were told it was revolutionary. Patients were promised relief from chronic suffering. And the pharmaceutical company behind it insisted that addiction was extremely rare. That drug was OxyContin. What followed would become one of the most devastating public health disasters in modern history. Millions addicted, hundreds of thousands dead, and billions of dollars in profits made along the way. At the center of it all was Purdue Pharma, a pharmaceutical company controlled by the powerful Sackler family. But how did a single drug trigger a nationwide crisis? And did the company know the risks all along? The story begins decades before OxyContin was ever created. The Sackler family built their fortune through pharmaceutical marketing and medical advertising. Over time, they transformed Purdue Pharma into a major player in the pain management industry. By the early 1990s, doctors in the United States were being encouraged to treat pain more aggressively. Pain was increasingly described as the fifth vital sign, something doctors should monitor as carefully as heart rate or blood pressure. This shift created a massive opportunity. Purdue Pharma began developing a powerful opioid medication that could dominate the market. That medication became OxyContin, a pill containing the opioid oxycodone, a drug chemically related to morphine and heroin. But Purdue claimed their version was different. They said the pill used a special time-release system that slowly released the drug into the body over 12 hours. According to the company, this design made addiction extremely unlikely. In 1996, the drug received approval from the US Food and Drug Administration, and Purdue launched one of the most aggressive pharmaceutical marketing campaigns ever seen. Purdue Pharma knew that doctors were the key to massive sales, so they built an enormous sales force to target physicians across the country. Representatives visited clinics, hospitals, and medical conferences. Doctors were invited to luxury seminars and educational programs where they were taught that OxyContin was safe and effective for chronic pain. The message was simple. Addiction was rare, very rare. In fact, Purdue repeatedly told doctors that fewer than 1% of patients would become addicted. Sales representatives used charts, brochures, and promotional videos to reinforce the claim. Doctors were reassured again and again this drug could be prescribed safely, even for long periods of time. Prescriptions began to rise, then they exploded. By the early 2000s, OxyContin had become one of the most profitable painkillers in the world. Purdue Pharma was earning billions, but something else was happening at the same time, something far darker. Patients across the country were becoming dependent on OxyContin. What Purdue rarely emphasized was that OxyContin contained a powerful opioid, and opioids have long been known to be highly addictive. Even worse, the pill's design had a dangerous flaw. If someone crushed or broke the tablet, the time-release mechanism disappeared. Instead of a slow 12-hour release, the entire dose would hit the body at once. This created an intense and powerful high. Users quickly discovered they could crush the pills and either swallow, snort, or inject the powder. Addiction spread rapidly. Communities began reporting rising cases of opioid dependence, overdoses, and crime linked to the drug. Small towns were suddenly facing a crisis they had never seen before. Doctors started noticing troubling patterns. Patients were returning again and again, asking for stronger prescriptions. Some patients visited multiple doctors to obtain more pills. Others began turning to illegal opioids like heroin when prescriptions ran out. The early signs of the opioid use disorder were appearing everywhere, but Purdue continued to insist that the drug was safe. By the late 1990s, law enforcement agencies and health officials were already raising alarms. Addiction rates were climbing in several regions of the United States. Investigators discovered that some areas had extremely high rates of OxyContin abuse, but Purdue continued promoting the drug aggressively. Internal documents later suggested that company executives were aware that addiction and abuse were increasing. Instead of slowing down sales, the company pushed forward. Marketing campaigns continued. Sales bonuses were offered to representatives who increased prescriptions. The company's profits kept growing. By the early 2000s, OxyContin was generating more than $1 billion per year, but the human cost was rising just as fast. Emergency rooms began seeing more overdose cases. Families were losing loved ones. Communities were struggling to deal with the consequences of widespread opioid addiction. The opioid epidemic had begun. As the crisis worsened, federal investigators began examining Purdue Pharma's marketing practices. They looked closely at how the company promoted OxyContin to doctors. Investigators discovered that Purdue had repeatedly downplayed the risk of addiction. Doctors had been told that the drug was safer than other opioids, but evidence suggested the company knew addiction risks were far higher than they had claimed. In 2007, the investigation led to a major legal case. Purdue Pharma and 3 of its top executives pleaded guilty to charges of misleading doctors and regulators about the drug's risks. The company agreed to pay over $600 million in fines. At the time, it was one of the largest pharmaceutical penalties in history. But critics argued that the punishment was too small, because by that point the damage had already spread across the country. Over the next decade, the opioid epidemic grew into a full-scale public health disaster. Prescription opioids like OxyContin had introduced millions of people to addiction. Many eventually turned to heroin or synthetic opioids like fentanyl, when prescription drugs became harder to obtain. The death toll continued to rise. By the 2010s, opioid overdoses had become one of the leading causes of accidental death in the United States. Entire communities were devastated. Families lost children, parents, and siblings. Emergency services were overwhelmed. Hospitals struggled to treat waves of overdose patients. What began as a pharmaceutical success story had turned into one of the worst drug crises in modern history. As the scale of the crisis became clear, lawsuits began pouring in. States, cities, and counties across the United States accused Purdue Pharma of fueling the epidemic through deceptive marketing. Victims' families demanded accountability. Thousands of legal cases were filed against the company. Facing massive financial liability, Purdue Pharma eventually filed for bankruptcy in 2019. The bankruptcy process was used to negotiate a massive settlement with thousands of plaintiffs. As part of the deal, members of the Sackler family agreed to contribute billions of dollars toward opioid addiction treatment and prevention programs. However, the settlement also granted the family protection from many future lawsuits. The decision sparked intense public debate. Some critics argued the Sacklers were escaping full accountability. Others said the settlement was necessary to provide funds for addiction treatment. The controversy continues today. Today, the opioid epidemic remains a major public health challenge. Millions of people continue to struggle with opioid addiction. Communities across the United States are still dealing with the consequences of decades of overprescription and aggressive drug marketing. The story of OxyContin has become a powerful example of how pharmaceutical marketing, regulatory failures, and corporate incentives can collide with devastating consequences. It also changed the way doctors prescribe pain medication. Many hospitals and medical organizations now enforce stricter guidelines for opioid prescriptions. Public awareness of opioid addiction has increased dramatically. But the damage caused during the early years of the epidemic cannot be undone. What began in 1996 as a new pain treatment eventually became one of the most controversial pharmaceutical stories ever told. A drug that promised relief, a company that promised safety, and a crisis that spread across an entire nation. The story of OxyContin is more than just a corporate scandal. It is a reminder of how powerful industries, medical systems, and regulatory institutions can shape public health in ways that affect millions of lives. And it raises a question that still echoes today. Could this tragedy have been prevented, or was the billion-dollar deception already set in motion long before the first pill was swallowed?